Hello, I am Dr. Namrata Agrawal, ICU specialist at Borivali Healthcare. Today, I want to talk about a very serious condition, bleeding in the brain, also called brain hemorrhage, and why these people often need immediate ICU care. So, bleeding in the brain can occur for several reasons. The most important cause is uncontrolled high blood pressure, which can weaken blood vessels over time. It can also happen after a head injury, rupture of an aneurysm, or due to blood clotting disorders. Unlike many other conditions, brain bleeding often begins suddenly. A person may experience a severe sudden headache, often described as the worst headache of life. This may be followed by vomiting, weakness or numbness on one side of the body, difficulty speaking, loss of balance, or sudden unconsciousness. The brain is enclosed within the skull, which is a fixed space. When bleeding occurs, blood accumulates and increases pressure inside the brain. This pressure compresses brain tissue and can damage the area responsible for breathing, heart function, and consciousness. This is why brain injury is so dangerous. Even a small amount of bleeding can cause serious symptoms depending on its location. Rapid swelling can make the situation worse in a very short time. Patients with brain bleeding are managed in the ICU because they need constant neurological monitoring. We check their level of consciousness frequently, monitor pupil size and reactions, and watch for any changes in movement or speech. Blood pressure control is extremely important. High blood pressure can worsen the bleeding, so medications are given carefully to maintain safe level. Oxygen levels are monitored continuously, and some patients require a ventilator if they are unable to breathe properly or are unconscious. We also give medications to reduce brain swelling and prevent further complications like seizures. Repeated brain scans may be needed to check whether bleeding is increasing. In some cases, neurosurgeons may need to perform surgery to remove the clot or to relieve the pressure on the brain. The decision depends on the size and location of the bleed and the patient's condition. The first 24 to 72 hours are the most critical. During this time, swelling can increase or new complications may develop. ICU care allows us to detect even small changes early and act immediately. Recovery from brain bleeding varies widely. Some patients recover well with timely treatment, while others may have long-term neurological problems. Early hospital arrival and specialized ICU care significantly improve outcomes. If someone develops a sudden severe headache, weakness on one side, slurred speech, confusion, or loss of consciousness, do not wait. Immediate medical attention can be life-saving. If this video helped you understand the seriousness of brain hemorrhage, please like, share, and subscribe to our channel. Awareness about emergency symptoms can help people reach the hospital in time and save their precious loved ones. Thank you.